Hello and welcome to the Trump Corner, and I am your host, Donald Trump. Thank you. You all are all so kind. It is great to see such a large audience today. Today we have a special for you. On my right I have the very own, one-of-a-kind Dr. Strange. Welcome, Dr. Strange. It is a pleasure to meet you.
I wish I could say the same, Donald.
Well, no need to be aggressive, sir.
It's Doctor, not sir.
Well then, shall we continue?
If we must. When do I get paid for this waste of time?
Anyway, what are we going to discuss today? Surgery? Treatment? Drugs? I love drugs.
Today, Donald.
It's Sir Donald.
Anyway, Donald, we are going to talk about Wellbutrin, also known by its generic name Wellbutrin.
Tell me more.
Well, Wellbutrin is an antidepressant. It is of the aminoctone class, and it is chemically unrelated to tricyclic, tetracyclic, selective serotonin reuptake inhibitor, or any other known antidepressant agents.
I guess you can say I'm like Wellbutrin.
What? That it doesn't make any sense?
Bingo.
How did you get this talk show?
Anyway, what are the dosages for Wellbutrin?
It is supplied for oral administration as either a 75 mg pill or 100 mg pill.
So what are the general dosing considerations?
Increases in doses should not exceed 100 mg per day in a 3-day period. No single dose should exceed 150 mg. Wellbutrin should be administered 3 times daily, preferably with at least 6 between doses.
But what is the usual dosage for adults?
300 mg per day, given 3 times daily. How much longer will this take?
Moving right along, what if my doctor wants to increase the dosage above 300 mg per day?
Well, it is important for the doctor to remember first that the effect of Wellbutrin may not be evident until 4 weeks of treatment or longer.
Long time.
Long time. An increase in dosage up to a maximum of 450 mg per day, given in divided doses of not more than 150 mg each, may be considered for patients who report no clinical improvement, considering the patient has several weeks of treatment at 300 mg per day.
What about maintenance?
The lowest dose is recommended. However, it is important to note that it is not known how long the patient should remain on Wellbutrin.
What if I have impaired hepatic and renal function?
It would explain a lot.
What?
Nothing. Wellbutrin should be used with extreme caution in these patients. With patients with impaired hepatic function, the dose should not exceed 75 mg once a day. With patients with impaired renal function, a reduced frequency and/or dose should be considered.
Great answer. Now answer this: what is Wellbutrin indicated to treat?
It is indicated for the treatment of depression.
Can babies take this?
No, you cannot take this drug.
That is not what I meant, Doc. Can the pediatric population take this drug, or is it only for adults?
Wellbutrin is not approved for use in treating any indications in the pediatric population. It is indicated to treat adults with depression.
Thank you. Are there any contraindications? Do you know what that means, Doc? Contraindications?
Let's find out. Wellbutrin is contraindicated in patients with a seizure disorder being treated with Ziban, current or prior diagnosis of bulimia or anorexia nervosa, abrupt discontinuation of alcohol or sedatives, inoculum benzodiazepines, concurrent administration of Wellbutrin into monoamine oxidase inhibitor, and an allergic response to Wellbutrin.
Sounds about right. You must proceed.
You do not need to tell me to proceed.
I shall. The following is a question I always ask my doctor about a medication he or she is going to prescribe me.
Okay, what is it?
How long does it take to reach Wellbutrin to peak plasma concentration?
It is usually achieved within 2 hours. Also, the half-life of Wellbutrin after chronic dosing is 21 hours.
My God.
Yes, I know. Also, the steady state is also reached within 8 days.
I might have to double-check that, but for the meantime my studio audience is probably asking themselves this question: what is the bioavailability of Wellbutrin?
Well, Don, do you mind if I call you Don?
Answer the question.
Right, well, the bioavailability of Wellbutrin has not been determined in human trials.
Disappointing.
Indeed.
What about metabolizing this amazing drug?
Well, according to the prescribing information from the FDA, Wellbutrin is extensively metabolized in humans. As a result, there is potential for drug-to-drug interactions.
I'm so confused.
I know, I'm not surprised. You are not a doctor.
Well, it depends on who you ask.
We will discuss more about the drug-to-drug interactions in a bit, Don.
Yes, sir.
Moving on, the elimination of this drug was conducted in a human trial dosage of 200 milligrams. The researchers found 87% and 10% of the radioactive dose were recovered in a urine and feces, respectively.
Just so me and my audience understands. 87% of the dose was recovered in a urine and 10% was recovered in feces?
Yes.
Fantastic. Are there any side effects with Wellbutrin?
Yes, some of the common side effects include agitation, dry mouth, insomnia, headache, migraine, nausea, vomiting, constipation and tremors.
Any other side effects?
Wellbutrin is associated with seizures in approximately 0.4% of patients treated at doses up to 450 milligrams per day.
Are there any recommendations for reducing the risk of seizures?
The risk of seizure may be minimized if the total daily dose of Wellbutrin does not exceed 450 milligrams. The daily dose is administered 3 times daily, and the rate of incrementation of dose is very gradual.
I once heard that some drugs have a black box warning.
Where did you hear that?
Fox News.
Figures. But yes, Wellbutrin, like other antidepressants, have a black box warning of suicide.
Tell me more.
It has been demonstrated that antidepressants increase the risk, compared to placebo, of suicidal thinking and behavior in short-term studies of major depressive disorder. However, these short-term studies did not show an increase in the risk of suicidality with antidepressants compared to placebo in adults beyond age 24.
How can someone help?
Patients who start antidepressant therapy should be monitored appropriately and observed closely for clinical worsening, suicidality or unusual changes in behavior.
Can family members help?
Of course, families and caregivers should be advised of the need for close observation and communication with the prescriber.
I have to admit, you are almost as smart as me. But don't let my amazing comment get to your head, Doc.
Yes, of course. Why hold I?
Now, Dr. Strange, what if I take a lot of medications, and I mean a lot? Is there a possibility that my Wellbutrin can interact with other drugs?
Yes. What kind of questions is that? Are we almost finished here?
Not even in the slightest. Are there any drugs that affect Wellbutrin?
Well done. Wellbutrin is primarily metabolized by CYP2B6. Therefore, there is potential for drug interactions between Wellbutrin and drugs that are inhibitors or inducers of CYP2B6.
Go on.
Some of the inhibitor drugs that can affect Wellbutrin include ticlopidine and clopidogrel.
Keep going, Doc. You're doing great.
Right, some of the inducers drugs that can affect Wellbutrin include ritonavir, lopinavir, efavirenz, carbamazepine, pentobarbital and phenytoin.
I remember learning about that in medical school. But can you tell our studio audience about Wellbutrin and its effect on other drugs?
I'd be happy to do so. Wellbutrin can affect certain antidepressants and antipsychotics, beta blockers, and type 1C antiarrhythmics.
What about drugs that lower seizure threshold?
The doctor, like me,
And me.
should use extreme caution when co-administering Wellbutrin with other drugs that lower seizure threshold.
Any other drugs to be concerned about?
Yes, dopaminergic drugs and MAO inhibitors. There are adverse reactions with Wellbutrin in dopaminergic drugs, and there are studies demonstrating acute toxicity with Wellbutrin and MAO inhibitors.
How long should a patient wait to start Wellbutrin if they discontinue their MAO inhibitor?
14 days.
Man, medicine is easy. I wonder why other people aren't doctors like ourselves.
Man, this is painful.
Maybe you need some Wellbutrin.
Anyway, shall we continue?
We shall. Tell me about the efficacy of Wellbutrin.
According to the FDA, the efficacy of Wellbutrin has been established in 3 placebo-controlled trials.
What were the trials like?
2 trials were for 3 weeks with depressed inpatients and 1 was approximately 6 weeks with depressed outpatients.
What if I want to take Wellbutrin longer than 6 weeks?
Well, the effectiveness of Wellbutrin in long-term use for more than 6 weeks has not been systematically evaluated in controlled trials.
Maybe we can do a controlled trial right here, right now with our studio audience.
That would not work, Don. The patients need to be clinically diagnosed with the major depression category of the APA Diagnostic and Statistical Manual.
Oh, never mind. At least we tried. So let's look at some tweets from our Twitter account to see what some audience members are asking us regarding Wellbutrin.
You have a Twitter for this show?
Sure do. One person asks us, doctors, is it possible to abuse and be dependent on Wellbutrin?
Well,
Maybe I should answer this.
I'll take this one, Don.
Fine.
There have been a multitude of clinical studies conducted in normal volunteers, subjects with a history of multiple drug abuse.
So what happened?
Well, it should be noted that individuals experienced with drugs of abuse, a single dose of 400 milligrams of Wellbutrin produced mild amphetamine-like activity as compared to placebo. However,
Yes.
recommended daily dosage of Wellbutrin when administered in divided doses is not likely to be especially reinforcing to amphetamine or stimulant abusers.
What if we tested these individuals with extremely high doses? I would try that.
I know you would. However, higher doses could not be tested because, if you remember, the risk of seizure is great, and according to the FDA, this might be modestly attractive to those who abuse stimulant drugs.
How about overdose? Is this possible with Wellbutrin?
As of today, there has been extensive clinical experience with overdosage of Wellbutrin tablets.
How many overdoses occurred in clinical trials?
13, where 12 patients ingested 850 to 4,200 milligrams. 1 patient ingested 9,000 milligrams.
Did these individuals recover?
They did. They recovered without further after effects.
Were there any seizures due to these overdoses?
Yes, seizures were reported in approximately 1/3 of all cases of overdose.
Any other serious reactions reported with overdose?
Yes, they include hallucinations, loss of consciousness, and sinus tachycardia.
What about people who reported overdosing with Wellbutrin and other drugs? Any reactions?
Yes, they include fever, muscle rigidity, rhabdomyolysis, hypertension, stupor, coma, and respiratory failure.
So what about the research regarding Wellbutrin?
What about it?
Well, tell us.
About the research?
Know the score of the Cowboys game. Yes, the research. Is there any research that responds to the controversial issues related to Wellbutrin?
Yes, there was controversy in terms of adding Wellbutrin to a mood stabilizer for bipolar patients.
Why was there a controversy?
2 reasons. First, Wellbutrin may cause seizures and has a risk of suicidal thoughts and behaviors. But more importantly, Wellbutrin, according to the FDA, is not approved to treat bipolar disorder.
Gotcha.
After clinical trials, the researchers concluded that Wellbutrin does not cause significant harm and may be a benefit to these patients. But remember, Wellbutrin is not approved to be used solely for patients with bipolar.
Fascinating. You are truly a great doctor.
Indeed, there is other research regarding Wellbutrin too.
Like what kind of research?
There has been couple research conducted for heterosexual couples. It was a 5-case study designed to test a comprehensive treatment for married women suffering from or depression and or dysthymia and hypoactive sexual desire disorder.
Understood. Tell me more, Doc.
These married women and their husbands participated in 15 to 20 weeks of cognitive behavioral, marital and sex therapy. In addition, the women were treated with Wellbutrin.
What did the researchers find?
They found clinically significant improvement in depression for 4 of the 5 subjects. 4 of the 5 couples showed an increase in frequency of sexual activity, and all couples reported greater satisfaction with their sexual relationship.
Sounds like Wellbutrin and psychotherapy go well together. You get it, Doc, well together.
Yes, Don, I get it.
Unfortunately, we are running out of time.
Thank God this has been one of the most painful experiences of my life.
I'm glad you enjoyed yourself today, but can you tell us something, Doc?
Sure.
Is there any information you'd like to tell our studio audience who want to take Wellbutrin?
Sure, people who take Wellbutrin should equally divide their doses 3 to 4 times a day. They should discontinue and not restart if they experience a seizure while on treatment. Wellbutrin may impair their ability to perform tasks requiring judgment or motor and cognition skills.
Should they refrain from any activities?
Yes, they should refrain from driving an automobile or operating complex hazardous machinery.
What about alcohol?
Patients should be advised that the consumption of alcohol should be minimized or avoided.
What about family? Should they be encouraged to be alert about anything?
Yes, families should be encouraged to be alert to the emergence of anxiety, agitation, panic attacks, insomnia, irritability, hostility, impulsivity, akathisia, hypomania, mania, worsening of depression, and suicidal ideation.
Now I usually don't do this,
Now what?
but I like to think of myself as the new era of opera talk shows.
Okay.
So, studio audience, I'm going to give you some Wellbutrin, and you get some Wellbutrin, and you get some Wellbutrin.
I don't think that's legal.
We will see. Until next time, thank you for stopping by Trump's Corner. This is Donald Trump signing off. Good night.